Here's what you can do to protect you and your family from smoke exposure this fire season. First, sign up for text or email alerts to know when a wildfire or prescribed burn is happening in your area. During a smoke event, reduce time spent outdoors and stay indoors in a tightly closed, air-conditioned setting for more protection. Protecting indoor air quality is crucial for your home. Let's protect our health this fire season. For more information and to get updates on the latest conditions, visit centraloregonfire.org.
Deschutes County is an amazing place to live,
Ease of access,
work, and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Episode 33. This is the Inside Deschutes County podcast. We thank you so much for listening. I'm Eric Breon. Well, we hope you're enjoying the cooler, late summer weather. I guess it's late-ish. We're almost to September. This is a place to get caught up on some county news, talk about county resources, and maybe more importantly, introduce you to the people who work at the county. They've got lots of good stories to share. We want to share those with you. On this episode, we're going to talk about comprehensive care for youth and families. There's a lot that goes into that. So I asked Program Manager Shannon Brister from Deschutes County Behavioral Health to come on the podcast and explain it. And not only explain, but just tell us what's out there. I'm not sure everyone knows, so we're going to do our best to inform. Shannon, thank you so much for being here.
Thanks for having me, Eric.
This is a big deal.
It is a big deal.
It's a big deal for me because you're a Husky fan.
Oh, yeah, big Husky fan.
This is I don't know. I don't know how this podcast is going to go.
Coug versus Husky. Who knows?
Yeah, for people who don't know, University of Washington, Husky fan. I went to Washington State. This is, I don't know.
Uncharted territory. Or is it?
But you went to Central Washington.
I did. I went to Central Washington.
How are you a Husky fan?
Oh, my dad bleeds purple and gold. And so as kids...
A lot of ducks on this floor, by the way.
I know it. Look out. But as kids, we just were raised to be Huskies. And my sister went to the University of Washington. She's the golden child. But I went to Central, and I loved it.
There you go. Well, all right. You can.
It's probably what brought me to Central Oregon, to be honest.
Really?
So
okay.
I love the weather. I love the culture. I love the environment. So
I can set aside my Wazoo stuff for one podcast.
All right. We'll call it truce.
We can do that. How's your summer?
My summer's great. Lots of beach time, family time.
Beach time, where'd you go?
I went to Coos Bay. I like to be on the beach, and we ride ATVs in my family, so lots of time doing that.
Dunes.
The dunes.
Shore Acres kind of cool out that way, too.
Never been there.
Yeah, Shore Acres, right in Coos Bay.
Oh, I just haven't been to Shore Acres. I'll go to Horse Falls Beach.
Super cool.
Yeah.
Got to go there during the king tides.
Okay.
The big waves and stuff. Oh, man, they hammer the rocks and
nice.
Huge waves, explosions. Anyway, it's really cool. We brought you on to talk about something that is pretty big, I think, in behavioral health. Comprehensive care for youth and families, but it's so much. I guess hence the word comprehensive, right?
Yeah, it's a lot. It's more, if you imagine one big team broke into a bunch of different specialties. So it's all kids, and my kids' term is loose, from 29 to 0, or 0 to 29. And so we have outpatient services for youth and families. That's your standard outpatient. You come in, you see a therapist, you might need some skills building, some psychiatric care. Those clinicians are fantastic. They see families with really diverse needs and high-intensity needs and do a phenomenal job supporting our community. We also have 7 school-based health centers, 2 in Redmond, 1 in Sisters, 2 in Bend, 1 in Lapine, and 1 in Gilchrist. And those school-based health centers are just that. They work with schools. They work with a medical provider in the Bend and Redmond sister school district. That is Mosaic Medical. And then in Lapine and Gilchrist, it's Lapine Community Health Center.
That's a big deal.
It is a big deal.
You got school coming up. So
Yeah, we got school coming up. And so they work collectively with the schools and the medical provider, and then as the behavioral health team, to provide this comprehensive approach to care for kids that are school-aged.
Does this work with the Healthy Schools program, or kind
Yeah.
of different, or how are those intertwined?
Yeah, our public health team works really closely with us. They provide education and do a lot with our schools in terms of awareness and prevention. And then we come alongside on the behavioral health side and then everybody works together seamlessly, schools, public health, behavioral health, and then that medical provider. And really it's about reducing barriers so young people can get access to care.
You kind of swoop in, and
We swoop in.
that's awesome.
Yeah.
That's awesome. A lot of acronyms with all of this. So
Yeah.
you've got intensive youth services.
So that's next, right?
IYS.
Yeah. After outpatient and school-based health centers, we have intensive youth services, or IYS. And that's really 3 specialty care teams. And now, most recently, a 4th we've added. But we have our Early Assessment and Support Alliance team. That is for individuals experiencing their first episode of psychosis. They're ages 12 up to 27. It's a 2-year program, and it's our only tri-county team. So someone who's experiencing their first episode of psychosis, they might see things, smell things, and it's a recent change. And they're things that other people don't hear, see, or smell. And so this is really important because we know that if we intervene early, recovery is possible. So we do a tri-county outreach. It's a very small percentage of our population, and we travel that very big footprint to meet everybody. The next team that we have in intensive youth services is our Young Adults in Transition program, and that's ages 14 to 24. Those are our
YAT.
YAT.
I hear about YAT all the time.
Yeah, YAT. That's a neat team. They work with young people who are launching into adulthood, but are often undersupported. So think about our LGBTQ community. Think about young adults who don't have a safe place to live, or whose parents may be struggling to help them launch into adulthood. Or maybe they just graduated from the foster care system and they don't have a community around them to support them. So our Young Adults in Transition program works along the young person. We offer skills building and peer support, substance abuse or use services. And so really cool. And it's kind of an alternative approach to therapy. It's not like, you think of therapy coming in and sitting or laying on someone's couch and talking like you see in the movies. It's not that at all. It's around taking someone into the community and helping them navigate systems for the first times in their life as a young adult. It's around teaching life skills and doing it in a learning environment, like going to the store and going shopping, things like that.
This feels like very much like a staircase approach to care.
Yeah.
You're starting at, it's like one step, next step, getting up. I mean, is that kind of
It is
almost how you relate to it a little bit? I mean, just in terms of you're starting with, okay, outpatient school, and then your early adulthood.
Well, hence the name comprehensive, right? Because we are looking at the person, not just around these are the services that we have to offer, but who are you, what do you need, and how can we support you through this array of services? Not just, here you go, we got one thing,
right,
and we hope it fits, right? So our other program is Wraparound. And Wraparound is a coordinated planning process. It's actually not a mental health service, but it is a team approach to care. So it is a trained facilitator who brings everybody in the child or young adult's life together to come up with one plan. So imagine if you're a young person and you're struggling in school and you need an IEP, and maybe you have a juvenile probation officer because you got in a little bit of trouble. Maybe you have DHS involved and you have behavioral health. And this facilitator is trained to bring everybody together to really focus on the youth and the family's voice and what their priorities are in terms of their life and how they're going to approach treatment or complete services. And that is a pretty unique program that we have. That's actually where I got my start.
Really?
Yeah. I started in behavioral health in Deschutes County 19 years ago as the first wraparound care coordinator in Deschutes County. So it's been really a great ride, and it's been awesome to watch this.
You've been here 19 years?
19 years in December, so I'm
Holy smokes.
little 18 in 8 months. Or
Okay,
whatever,
so you've seen your fair share of things and seen this program grow.
I have.
I
seen it
imagine
grow.
it started
It's
as like this and has just kind of
there
blossomed over
was
the
no
years.
there was no school-based health centers. There was no ESA. There was no YAT. There was child and family outpatient, and then there was wraparound. Just a little baby wraparound coming in.
Little baby
Little
wrapper.
baby. Yeah. And recently, this last couple years, we got a BURN grant, Behavioral Health Resource Network. And that grant really allows us to hire a substance use counselor and a peer and bring them in and provide outreach to our young people who are misusing substances and get them the support that they need early, provide a lot of prevention, talk about harm reduction models or approaches to care. So that's, comprehensive. We're pretty comprehensive.
I would say that fits the word.
It does.
Yeah. ESA? Did we talk about ESA?
We did. That's that first episode.
Okay, that's
Psychosis.
the first one.
What we
Okay.
haven't talked about yet is our drop-in centers.
Well, there's that. The drop.
There's that. The drop. So the drop started in 2015, and it is a safe place to be for young kids. And I say kids again, young people. How's that? Young adults. And that term was coined by the young adults attending at that time. They wanted a place to go that they could just be and have it be safe, and they could socialize with other people with similar interests. So there's a couch, a TV, a bunch of games, a laundry facility, place to get coffee, small refrigerator, a book nook,
These are nice facilities.
Yeah, these are nice facilities.
I've seen them both. There's one in Bend and a new one in Redmond, fairly new.
The second one just opened in January of 2024, so we're really excited about that.
So you can go in there. There's nice couches, hang out. There are computers. You can play video games, watch movies, do puzzles. I've seen people doing artwork, pottery, painting. There's a lot there.
You name it. Yeah, we have quite a few amazing artists in our young people. But you can, again, just a safe place to be. So anything and everything. And our young adults are so creative, and they enjoy socializing, and just, again, puzzles. Puzzles are huge. Just putting together a puzzle.
Just doing it.
Yeah.
Well, I want to play a clip from a video that was produced to explain the drop. Here's some of the people who work there, peer support specialists, talking about why that work is so important.
When I was a young person, I didn't have any kind of peer mentors or anything like that.
I know that I would have loved to have something like this, and I know I have people walk through the door happy from the community that they can have somewhere to go.
It's been really cool to see this continue to go and have other people take the same amount of pride that I did when I first opened it.
I do this job because it makes me feel like I have a purpose.
And I struggled with mental health, and I struggled with addiction, and I think now that I'm in recovery, long-term recovery, and from both mental health and substance use, I think that it's really essential for young people to kind of have that support.
And I love to be able to help my community and feel part of something big that makes a huge difference.
As more and more people started to come, we were able to develop more and more programming.
Before they get as bad as I did and as other people do, and to hopefully have that advocate and that person that can be by their side and kind of walk them through it, that's experienced it, I think is really vital.
Those are members of your team.
They are. Aren't they awesome?
That's pretty cool. What does hearing their words, how they explain why that work is important, when you hear that, what does that make you feel?
Oh, proud. Incredibly proud. A little emotional, too, because I know how far we've come, starting from a small team and growing. But those three, as well as the other, there's almost 50 people on my team that are in our community, and they carry that same passion that we're here to help, and we want to offer services for young people, and we want them to know that they're not alone. So it's emotional, but really proud of the three of them, and as well as everyone else that works so hard to make the drop just amazing.
Shout out to Teresa,
Michelle, Dustin. Yeah, but there's so
many others.
There's
right?
so many more. Chelsea and Olivia, they all run our drop-in center, and it's pretty incredible.
How do people react to the fact that because they have some shared experiences? Talk about that connection a little bit. I know you can't share, specifics and, be sensitive to what people are going through, but I'm sure that connection is really, really important because they know that person has been perhaps where they are.
Yeah, that's the power of peer support, and you'll see that in all the evidence and the investment in Deschutes County. I think we have over 30 peers now that work for the county, and we invest in, we partner with Central Oregon Community College to train peers so that they can do this, because knowing that somebody else may not have the exact same experience that you have, but they have walked in similar shoes, and they know what it's like to be in pain or to be lost or to feel lonely or to just not know what to do. So now you have someone who has that lived experience, has found a pathway out, and has found success in that pathway. And so it's inspiring. They can say, I may not know exactly what it's like for you, but this is my experience, and this is what worked for me. And there's power in that. It's not someone with a degree or a lot of letters behind their name telling you that. It is someone who's actually traveled that very similar path and successfully navigated it.
There are probably a lot of tears in this job, I would imagine. I mean, you talked about the emotion, just reacting to hearing from your team. I'm sure you've seen so many people grow, learn. I've heard your team talking about people getting driver's licenses and learning how to do laundry for the first time. How do you process all that? You've done it for 19 years, and now you've seen these services grow in Deschutes County. That's a big deal.
Yeah, I mean, it's why we do the work we do, right? But these are not our accomplishments. These are the young people's accomplishments. And we are privileged to get to sit beside them and witness that. So it's just that's what we hang on to, right? It's an honor to get to be able to do that and watch a kid blossom and to help them find what they already had within themselves, right? But just to guide them through that. But the successes are not ours. The successes are the young people. And so, yeah, there's some emotion in that. I don't know about tears. I don't cry a whole lot. But
well, you got to be pretty strong to do this,
I would say
too.
Definitely a lot of passion. And when you see a kid thrive and grow and get to witness that, that's what keeps you coming back for more. And that's how you have longevity in the field. For there's a lot of burnout in the field, but there's a lot of happiness into it. Recovery is possible. Right? And so to be able to instill that hope that you can do this, you can get better, and it's okay to ask for help. There's a lot of stigma in mental health and just asking for help. So just being able to plant that seed to say, it's okay to ask for help.
Well, knowing that you've had victories, right? I mean, you can point to some of those as being, for people who are new to your programs, come in confused, not knowing what this is going to be like. Knowing that there's probably some roller coasters along the way, that there's a light at the end of the tunnel for them. And so that probably provides you and your team with just this we can do it mentality, right? Yeah. Like and the strength to come in every day to do this work.
Yeah, and on the flip side, when things don't go as well as we want them to, it gives us the motivation to fix things and improve things, continually looking at how do we support our community, how do we do that better. And so there's a lot of motivation and a lot of compassion and a lot of passion in the work that we do.
So how do we do it better? You've got a great program. It's comprehensive, but I'm sure you're learning every single day.
Every day.
About what else might be needed, what else could be done. What are you finding out as you just attended a big conference? Like what's next in the world of comprehensive care?
Yeah, so we have to keep listening, and we have to keep listening not just to what we think is going well, but what our community tells us is going well and what our community tells us is not going so well. So we recently just did a big presentation to some state representatives and some key stakeholders about bringing children's residential to this side of the mountains. Our families have to drive 147 miles to access psychiatric residential care. We have inpatient stuff, but we don't have, outpatient services, but we don't have inpatient. That's a long way to have to drive, and imagine having to drive over the mountain in the winter. So we just presented the need for that, and we're working on it. And this takes years to do. This isn't something overnight. You have to keep at it, get investors, and keep pushing the needle in terms of Oregon administrative rules and how we resource things. So we just keep pushing, and we listen, most importantly, to what our youth and family are telling us and where our gaps are at.
You know how to push.
Know how to push
Just
at the pacing that we
gently,
need to, right?
Right, like a little bit. I mean, I've been in meetings with you where you're like, well, we can do just a little bit more.
Well, and our youth and families need it. We know that the second leading cause of death in Oregon is to young adult suicide. We know that. We have to do better. And so we can't just keep it status quo. So that's why we build things like the DROP. That's why we have 7 school-based health centers. That's why we have our first episode psychosis program. It's why we do wrap around and bring our community together. And, that's why we sometimes have to expand services. We're a pretty large county, so we have to make sure that we're accessible.
So how do people get connected with you and your teams?
Yeah.
Because I'm assuming, there's probably some sort of evaluation, consultation process that goes through it. What can people expect if somebody's listening to this and they're like, man, this could really help somebody in my family? What should they do? And then after they do that, what can they expect as they go through some of these programs?
Yeah, so there's a couple different avenues. One is just to call our access team, 541-322-7500, and ask to be connected to services. So who can call that number? Parents with a child under the age of 14, or if they're over 14 with the child. And then you can also call our intensive use services line, 541-213-6851, or email us at intensiveuseservices@deschutes.org. So kids over the age of 14 can consent to mental health treatment in the state of Oregon. So kids can access care through our school-based health centers. Easy to get in. They can ask, that they can, with their school, they can be connected, and we always want parents involved, but they can consent on their own. They can call in and ask to be set up, or email us. That's on the parent and kid side. If you're a provider and you get parent consent, we also have an intensive use services screening form, and the provider, school teacher, other professional can get consent from the youth or parent, and we will call them and we will do some outreach. So there's a few avenues, but the main thing is to contact us.
So this isn't all dependent on the youth necessarily.
It is
like
not.
A family member can reach out on behalf of the youth to start something, right?
Yeah, absolutely. Families can contact us. And again, youth have rights in the state of Oregon. 14 can consent on their own. So they have to be a willing participant, but we will reach out and we will talk and inform about what our programs are and how we think we can help. The nice thing about the drop-in center is you don't have to be a client to attend the drop-in center. So if you're 14 to 24, you can just stop by and see us and kind of check us out and assess us before you want to join services. Once you come into services, you'll get your first appointment, which will be an assessment, where you'll talk to somebody about how we can help. We want to learn more about you, and we want to get you connected to the right team member. And so our access team does a beautiful job of that. And then after that, you'll get assigned to your primary therapist or team that will support you.
Man, that's so important. So great that these services are out there. I'll say that the drop is all over the health services social media pages. They have like specific nights or events that they do. Like you can go and check out, I don't know, I'm trying to come up with an example off the top of my head, but rock painting.
Yep, we just did a rock painting party.
Yeah, like rock painting has been one, and then there's just been other parties, and you guys are so good at trying to get the feedback back from them, asking what it is that they want and what is it that they need or hoping for from programs like yours.
Yeah, we just did a big collab and gab, so collaboration and talk, basically, where young people came in and gave us feedback around how we're doing. What do we need to keep, and what, if we were going to change anything, would they focus on? And of course, the key to young people's hearts, often food. So we,
Pizza.
Pizza,
there.
and additional snack items. But that's important, right? And so we want to take their ideas and incorporate them into everything that we do. Because again, the drop really isn't about me or my team. It is about the young people coming in and how we can help.
Yeah, I would think that would be crucial.
Yeah.
Right? Like, hey, tell us, what do we've got ideas, but we want to know what you want, and help support you.
100%. And there's a saying that says, nothing for us without us. And that's true. So why would I create something or have my team create something that doesn't include the voice of the people that are going to come and utilize the space?
Well, what a cool program. I mean, how cool that you're obviously get to help, lead the way on this. But man, so the comprehensive aspect to that, it just seems so incredibly valuable, important, reaches a lot of people where they are in their life and in their whatever challenges they're facing. Man, kudos to you. Congrats to you and your team for all the work that you're doing.
Well, thank you. My team's incredible. So I just get to be the one that comes in every day and watches them do their work. It's pretty cool.
And not too bad talking to a coug, right?
Not too bad. I think we'll survive.
Shannon Brister, thank you so much for joining us.
Thanks, Eric.
If you want more information about comprehensive care, you can go to the behavioral health section on the Deschutes.org website. You can also email intensiveyouthservices@Deschutes.org or call 541-322-7500 to get set up with an appointment. And remember, you can listen to us wherever you listen to your podcasts. We're on Apple, Spotify, YouTube, you name it, or you can find us at Deschutes.org/podcast. But until next time, please be safe out there.